Hi, this is Dr. David Stoker, board-certified plastic surgeon in Los Angeles. We have one of our beautiful patients with us today who is from Texas, and she flies home tomorrow. She is also a doctor. And she did a lot of research to find somebody who could help her with a circumferential body lift. It included a buttocks lift, a thigh lift, and as well as a tummy tuck operation to smooth out her thighs. She had had her own experience with other plastic surgeons and has traveled around the country seeking the best doctors. And it's really generous of her to share her story and her face and beautiful smile with us. But I wanted to ask her a few questions. I do a lot of this surgery. Right at this very moment, we have people from all different states in our office who we've done similar things to. Tell us a little bit about what brought you to my office today from Texas.
I just had insecurities about my body and was exploring many different options as far as a reasonable and effective outcome. And as you know, there are so many minimally invasive things that are preached from the rooftops that give very minimal results. And after lots of research, I found you and your archives, and the results I saw were astounding and far above and beyond almost anything else I'd seen anywhere.
The photo gallery.
Photo gallery.
Yeah, that's the bottom line, isn't it?
It is.
Yeah, we can be very persuasive, charismatic, have a beautiful office, but the before and after pictures aren't very plentiful and
That's
impressive.
all that matters.
Yeah, or at least as a precondition to anything else, right?
Yes, sir.
Okay. So you found some, and even for exotic procedures like a body lift and buttocks lift and thigh lift, I have a large amount on there. So, you tell us about some of your previous experience with plastic surgery.
I'd had a breast augmentation, very, very happy with it. I did have one round of liposuction, not really realizing that at my age I could not get that skin shrinkage afterwards, and it actually, I feel like, exacerbated the problem, the laxity that I was trying to correct. So I knew that it had to be a different procedure and a different approach.
Okay, so you made it out here now.
Yes.
With great hopes, and it's not your first rodeo, and because you've had other plastic surgery and you're a doctor yourself, so you're a savvy consumer. You cut through the BS probably pretty well. So now that you've been here 2 weeks and actually experienced one of the biggest operations we could do on you, you look pretty beautiful there, just sitting there 2 weeks after a giant operation. What's your experience been like?
The experience was great. I do think it's important to be in the best shape possible heading into this procedure or similar procedures, as far as strength and general health.
And you can say that because you are.
I tried to be. I tried to
She's
be.
very fit.
It made a big difference in my recovery. I really do feel like.
Good. Okay, and so what about, you had high expectations for me and for my office. Now you have the reality of 2 weeks post-op. So did we meet your expectations?
Above and beyond, definitely.
That's
Just
nice to hear.
Couldn't be happier.
It's not easy to be happy after doing a really big operation like this, but
Correct.
I guess you looked in the mirror once or twice and it gave you a
little bit.
Okay, good. You can see that smile on her face there. That's what really drives me, getting a great result that's going to enhance your life like that. Okay, let's talk about the costs a little bit. I realize that you're doctors, you have a good income and so on, but it's a lot of money to do this, right? It is not cheap, and you also got on a plane to fly out here and the hotels and all of that. Was it worth it?
Very much so. I could have traveled to other parts of the country and paid less, but it was worth every penny to be exactly where I am.
Good. So we exceeded your expectation. The result is beautiful. We've got no problem so far. We're showing off the results. All of that sounds really good. You ready to fly home?
Ready to go.
Okay.
Yes,
Thank you so much for sharing. This is very brave of you, and I know it's going to help other people out there. I
hope so.
I won't be able to do this forever. It's a lot of hard work doing this, but right now, at this stage in my career, it's really fun to deliver exceptional results to some extraordinary patients.
Great.